healthcare accreditation in Australia, creating alignment for improving outcomes. I'm Stephanie from WorkSafe Tasmania, and I'll be your moderator today. In recognition of the deep history and culture of this island, we acknowledge Tasmanian Aboriginal people, the original and continuing custodians of the land, sea and sky. We acknowledge and pay our respects to all Tasmanian Aboriginal people, all of whom have survived invasion and dispossession and continue to maintain their identity, culture and Aboriginal rights. We now ask that you take a moment to read the following slide about information received today. Please use the chat panel to type and submit any questions for today's presenter. Those questions will be answered at the end of the webinar. There are also 2 handouts that you can now download as part of today's presentation. So please head to the handout window on your chat screen. Today's webinar is also being recorded and only presenter webcams will be used. It is now my pleasure to introduce today's presenter, Dr. Deb Carnes from Resilience Coach. Deb is a registered nurse focused on safety culture and workplace wellbeing. With 30 years of experience in nursing, labour movements and research, Deb began addressing psychosocial risks over 20 years ago as a union industrial organiser. Deb supported colleagues with workplace issues in health and education sectors. Deb holds a PhD in Organisational Safety and Healthcare Errors and a Master's in Mental Health Nursing. Deb is a member of the WHO Global Patient Safety Network, the Australian College of Nursing and the Australian College of Mental Health Nurses. And we welcome Deb today.
Thank you, Stephanie, and thank you everyone for attending today. I'm really looking forward to the presentation, and it's really great that you've been able to join us today. Before I go through the outline for today, I would just like to talk a little bit about how it came about. I have got this interest in particularly psychosocial safety, and I developed a one-day workshop, but I was about to start advertising around that, and the opportunity came up to put in a paper for the conference, and I had a feeling that the conference would be knocked back because it was very specific, and it was great to be able to do this 1-hour presentation here today. I have a coaching background, so the presentation today might be a little different to what you're expecting or what you're used to. It's been designed to adapt to take into consideration your knowledge, and for me to be able to find out what some of that is I've used a lot of polls in this, so I can, not testing you or anything like that, it's so that I can get an idea of who it is that's turned up today and what your background is and what your existing knowledge is, so that I can design the presentation around that as we go. There are 2 sets of handouts. There's one that's the traditional sort of handouts with the notes pages, and then there's a larger version where each slide is available to you in full, because sometimes those little handout ones are hard to read. So, and it is going to be recorded as well. So the way I've designed the presentation is taking into consideration lots of the different copyright that might be out there. So I don't want to breach any copyrights while I'm doing this. So I'm going to start off with some of the learning objectives and the key takeaways that the session's been designed around, looking at current costs and economic impact around work health and safety, particularly around mental health. Look at the WHO Charter for Health Worker Safety and Health Service Accreditation, looking at quality improvement principles. And then if there's time, start to look at things around the individual and organisational factors. But I've put those in there in case it falls a bit short. So we might not have time to get through those today. And then there's the conclusion, and questions will be at the end of the session. So first poll. Looking at, do you actually, are those people that are here working in the healthcare and social assistance industry in Australia? I haven't got any answers yet. Yes. Oh, so there's someone who doesn't. Okay. Well, it's useful for me to know. Okay, so it's about a 50-50 split. Okay, and the next question is around, if you work in healthcare and social assistance, which sector do you work in? So that way I can start to... Okay, so mostly from the hospital sector. Okay, someone else. Oh, and someone from community. Okay, beautiful. And an idea of the works role you have. So whether you work in a clinical practice role, administration, the support services like housekeeping or cleaning, or whether you work in another area. Okay. Okay, so there's a bit of a spread, and that's really it's really useful to know that, because we do tend to function in the accreditation space that, like, HR tend to be the group of people that have the responsibility for work health and safety, and then the accreditation around clinical practice is the clinicians, and this is a session which brings some of those together. So that's okay, so the learning objectives today, looking at discussing the current landscape of mental health work, mainly around mental health workers' compensation and the costs in the industry, and also looking at the WHO Charter for Health Worker Safety, and looking at getting you to move towards some practical approaches to how you can incorporate that management of psychosocial safety risk within the health service accreditation standards. So because most people here today are from that hospital sector, I will focus on that a little bit more, so that you've got something to take away today. So next. So I guess the next few polls is to look at how confident you feel around discussing some of those costs. Okay. So again, there's a bit of a spread. And how confident are you around the World Health Organization's charter? Okey-doke. And I think there's another one. How confident are you at incorporating that psychosocial safety risk into accreditation standards? Now, this isn't something that I'm aware of as happening at all. I just I have a sense that it might be on the way in the future. Okay, excellent. All right, so I'll be focusing on that quite a bit as well. So the takeaways for you is that recognition of the importance of managing it within the current context of health worker safety and patient safety, increasing your awareness around the global and policy agenda at a national and global and national level, and perhaps getting some, hopefully, most important thing is getting some practical insights in how all of these things line up together. So, just got... Now, I've just put my contact detail up there as well. So that's my email. It's the best way to contact me. But also, it gives me an opportunity to also remind you that today's session is being recorded. So it's not necessary to sit and scroll and try and get every detail down. You will have the capacity to be able to come back and watch the session and hone in on something. The other thing too is that when you look at the handouts I've given you, I haven't put a reference section. I've put a bibliography. So if I mention something that's not in that, then I will give you the information as to where you'll be able to find it. But I'll also, there's things in it that I might not mention. And it's a mixture of stuff from Safe Work Australia and stuff from there's a couple of good textbooks in there in terms of some of the nitty gritty, depending on the area that you're working. Like there's a textbook that looks at student welfare and wellbeing and resilience. So you've got those. It's more of a resource than a reference. So current costs and economic impact. Again, there's a poll around that. So which one of the following industries has the highest number of workers' compensation claims? Yeah. And that is spot on. And which industry has the highest number of workers' compensation claims for serious mental health injuries? Yeah, and it's growing, and it's growing really, really, really quickly. Why is it's a difficult one to answer. Yes, COVID has had public administration and safety is up there, but it's not quite the highest. So COVID certainly has had an impact on health services, and but there's also the fact that psychosocial safety has become more prevalent. We now have definitions in legislation around bullying and harassment in the workplace. There's a lot greater focus on sexual assault in the workplace as well. So there's a myriad of things. So, it could be that there's more of it happening, or it could be that there's now greater awareness and people are now more comfortable coming forward and putting in their workers' compensation claims. So moving right along. So this is not a particularly clear slide. That's why I've given you the larger handouts. But there's well over 200,000 claims in the healthcare injury. And that was just, I think that's 22, 23. So this data is from Safe Work Australia, and they've got this really great dashboard that you can go in and actually filter things down. And so I did filter down for Tasmania. Unfortunately, I copied in the wrong slide. So that's the last one. But the healthcare and social assistance industry in Tassie had 10,085 claims for serious injuries, 5,000 in manufacturing, for 4,800 odd for public administration and safety, and 5,205 for manufacturing, construction 4,803, and public administration was 4,628. So that's quite a few for our tiny state. Now, this is the claims for serious mental health. And let me just make my glasses on, sorry, so I can. So this is for serious mental health. And this is Tasmanian data. So I've drilled it down for Tassie. So healthcare and social assistance is the highest, but public administration and safety is also very, very close. So, and the data is showing that it's much more in the white collar areas that this is an issue. Now, what's my next? So the next slide. The other thing is that is the estimations of the cost. So the Productivity Commission did an inquiry a few years ago, and following that there was the Australia Institute, and the reference is in the bibliography, and they showed that the cost of mental health generally to the Australian economy is something like 200 billion a year, but of that, up to around 17 billion is work-related and comes from the workplace. So that's quite a significant cost to our economy and to any business as well. But I won't dwell on that so much, because most people seem to think that or answered that they were quite confident around that. So yeah, so up to $17 billion. Like when you look at the WorkSafe data, it is possible to look at the number of claims. So say 200,000 in Australia in healthcare. So let's say the 300 odd claims for mental health in Tassie. You can work out what the average is. I think the average cost of a claim of all claims in Tassie was something like 10,000, which is not a huge amount. But the mental health claims do tend to be higher. You can work out that average cost in terms of the workers' compensation scheme, but then as an organisation, you have those replacement costs. Someone's on workers' comp, they're not working, that work has to be done elsewhere. You need to replace that person. If you can't replace that person, then that workload has to go elsewhere, and you're also already starting to look at increasing the workload in your organisation. I don't know if anyone is aware there's a tool, I didn't put it in the reference list, it's the Drake costing tool. You can just search for it in a search engine, and that actually takes you through what the cost is to replace somebody in the event that they leave your organisation. It looks at things like the advertising costs, the time it takes, the costing of the people doing the interviews, all of those sorts of things. And you can start to work out what it is as a cost to your organisation, and that all gets added into what those costs are for a business. So it's a significant issue. Okay, now, so the World Health Organization's charter. So there's another poll. So before this webinar, were you aware of this particular charter? Oh. Okay. So I'll just go back because it's got the photo. I've put the photo at the top. You'll see the date, 17th of September 2020. So the 17th of September is World Patient Safety Day, World Global Patient Safety Day. And of course, 2020 was COVID. So it was during that time that the WHO put together a charter around, because they don't just work across some developed areas, they work across the developing world as well. So they put together a charter that outlined responsibilities at the global, national government levels, and looked at some core principles. And so when you think of psychosocial safety, which is obviously anything that can cause psychological harm, then the charter looked at a commitment to the values of health worker safety as a priority. And so things like workplace stress, burnout and mental health come in under that area. Also emotional exhaustion and patient safety. There's a goal around developing and implementing national programs for occupational health and safety of health workers. In Australia, we've got some pretty decent work health and safety legislation, and there's also the code, code of practice for managing psychological risks at work. So we've got some of those things in place. Protecting health workers from violence in the workplace. That's something that's an ongoing issue across all areas, but particularly in some of the more acute spaces, as the emergency department, which is somewhere I've got a background in. But also looking at improving the mental health and psychosocial support for health workers, and establishing synergies between health safety and patient safety policies and strategies, a zero harm culture in our health system, and advancing the health worker safety through regulatory and legal frameworks. And we've certainly got a lot of those in place here in Australia. So we're quite fortunate, but it's a document that's designed to work at a global level, but that can then filter down. Where it was really significant is that recognition that patient safety, health workers' safety is a really, really, really vital part of that. And I'm not sure that that's been something that's at front and centre. And certainly in my discipline, nursing, there's I guess, an underlying culture of that came through in some of COVID as well, where people put their own safety on the line to be able to care for people during that pandemic. And there were some places, where people didn't have PPE, but there was an adequate supply of PPE, parts of the world, and nurses were still in there doing their work, and medical and other allied health professionals as well. So that's where that charter came from. And at the time, I think it's a very significant document in making that very, very clear distinction. So the next part of the discussion is around the accreditation systems in your workplace. So, the next poll is looking at the accreditation system that applies in your workplace. So just help you get an idea of, I suspect most people are from hospitals, so that's probably where the bulk of people will be, but okay. I mean, there are other areas out there. Okay, so there's someone here from the aged care sector as well. No one from disability? Okay. They're all very, very similar in terms of what they contain, the standards. And if you look at them, you can almost map some of them across. There's governance issue, there's governance stuff, there's patient or client, or in the NDIS the word participant is used. There's infection control, all of those, medication safety, all of those things are there. It's just that they're organised differently, and of course each of them has a separate process, and there are obviously people out there. Some organisations just have the one, but it's becoming more common that some places are having to work towards each of them. So most are actually outside of either of those. Okay. I'm wondering if there's any people here from general practice, because general practice have an accreditation standard as well. So I'm starting to move now towards some of the how you start to think about implementing. I've called it quality improvement principles. I'm not sure if that's what it really is, but it's about that getting into doing. At this point, I'd also like to just make a distinction between evidence-based practice and compliance, because they are two different things. And if you are implementing best practice and you are evaluating how well you're implementing best practice, then by definition you will be meeting, you will be compliant. Focusing on any standard, any accreditation process purely for compliance and ticking a box is a really potentially dangerous area to find yourself in, because you focus on ticking that box and having a list and doing things rather than focusing on that best practice implementation. And James, I'm sure everyone's familiar with James Reason. He's the guy who came up with the Swiss cheese model, who has now since discredited his own model. He was very, very strong early on in his work around having checklists. But his more recent publications, I guess even up to a decade ago, when he started to say that the actually Swiss cheese model wasn't the best approach and the checklist is not the best approach. Our brains like to tick that box, and our brains like to do things the same way each time. And if you're just focusing on that checking of the boxes, then you're not necessarily going to be doing everything necessary to keep your workplace as safe as possible. The safest workplace, any workplace is only as safe as its most unsafe employee. And in the health sector in particular, there's quite a high turnover of staff in some areas. So every day you have a different system. Every day you have a different group of employees that could be coming in and out of that system. And Reason himself has actually gone through and outlined Organisational Accidents Revisited is the text I've put in the bibliography, and that and other texts. He's gone through the differences between healthcare and other industries, because you have a patient in a system with a lot of different people looking after them. There's medical professionals, there's nurses, there's allied health, there's the people in the administration, all looking after that person at various points in their journey. But then each of those professions and work roles has a lot of patients that we're looking after as well. So there's so many, a high level of complexity where things can actually not go so well. So the Plan, Do, Study Act, it's been around for quite some time, and it is, I'll go to my poll, sorry. So I'm just curious as to how many people actually know about that cycle. Yeah. So it stands for Plan, Do, Study Act, or Plan, Do, Check Act. It's come from the business sector. You hear it a lot around Lean, Six Sigma, and some of those systems. And I guess the main issue with any sort of quality improvement is that you can put in place education programs. Everywhere has training these days around bullying and harassment, other sorts of areas within like psychosocial safety risk or other risks, manual handling, etc. But the big question around this particular cycle is, how do you know, like you're running all these education programs, people are doing them. So yes, they're ticking the box, but is what you want to happen actually happening in your workplace? And that's where the challenge can come in around how you design your quality improvement program and making sure that you do that planning at the start. So you don't just go, oh, we need this particular education or we need this particular program, but making sure that you know what it is that you want to change and what sort of data that you are going to use to know that you've made an improvement in the outcome. So let me see. So let's look at, so now looking at, so some of the psychosocial safety risks, they're outlined in the broad psychosocial risks are outlined in the code of practice, and it's things like job demands, low job control, poor support, lack of role clarity, poor organisational change management, inadequate reward recognition, poor organisational justice, exposure to traumatic events, and they are things that health workers experience. And you're looking at things like workplace stress and burnout. It happens. High workloads, emotional strain, high pressure, and there's certainly quite a lot out there in the literature, and some of the texts that I've put in the bibliography are sources where you can get some information around things like burnout amongst paramedics, those sorts of things is in some of those. Exposure to trauma, post-traumatic stress disorder, secondary trauma, but also one of the things that happens as well is when there's a major incident and we've had some of those in Tassie in the more recent times, is there's a thing called it's called second victims. And so, you know, if there's a major event and there's, say, some harm, it results in patient harm, there's the clinician that's involved, but then their colleagues can become second victims. So even though they're not directly involved, they can also experience trauma from what their work colleague and the patient or consumer in the system has been exposed to. So that's another area of where there can be exposure to trauma. Workplace violence and harassment, there's quite a lot in the literature around that within the healthcare settings. Moral distress, work-life imbalances, shift work, those sorts of things, isolation, feeling as though there's a lack of support, lack of peer support, stigma around mental health issues as well. Some people who work in the health sector have their own mental health illnesses, a lack of control and organisational stress, and of course the whole pandemic thing has come in on top of a lot of that, and also compassion fatigue. So there's some of the areas that that are needed to be considered in psychosocial hazards for healthcare workers, and then it's like, well, what's the next step? Is, well, okay, what is of concern to you? So, and that would depend around your data in your workplace, and you know, is it an issue of sick leave? One of the things that the Productivity Commission, I'm not sure the Productivity Commission looked at, but the Australia Institute report that's in the references, they looked at the issue of presenteeism in the workplace, where people are actually at work but they're not really at present and working in their jobs, and there's a significant cost to the industry there, to industries there as well. So those are the sorts of risk factors, and then it's a matter of, well, you know, do you have a high work turnover of staff? You might want to look at, do you have high workers' compensation claims? Do you have a lot of sick leave? And you know, so that might be an area that you want to look at in terms of an outcome or a change in your data when you move to implement something around how you're going to manage these risks. So I'm not going to go into that so much. What I'm going to look at now is, because I'm conscious of time, is how the actual standards line up. So I'll start with the hospital sector. There's several areas where psychosocial safety risk might come into your accreditation. So looking at your leadership and your culture, and how you might look at things like stress, burnout. Are these things that you actually measure in your current workplace? Are they things that you're tracking? Things like work, and if you're not tracking, are they things that you want to track? Workplace safety is something that I'd say would already be in your clinical governance process, but looking at things like workplace violence, harassment, stress. Again, is that something that you either collect or use your data? Incident management and complaint systems as well. Partnering with consumers can be impacted, because if you have health workers that are working in a high stress, high emotion environment, then that has an impact on their ability to interact with patients, consumers, which means that there's a risk of compassion fatigue as well. And it also reduces your ability to communicate and to partner with consumers.
Sorry to interrupt, Deb. Can I just check? The slide is currently sitting on poll 11.
Sorry. Yep. No, that's fine, because I'm just talking through stuff. Yeah.
Oh, that's okay. I just wanted to make sure that was all right.
No, I haven't, because I wasn't sure where people were coming from. So, and then other areas around comprehensive care. moral distress, ethical dilemmas, they can come into having an impact on your ability to deliver that care, cognitive and emotional capacity, and how you can communicate as well, because where you have people who are working in a stressed environment, then that can have an impact on your communication breakdowns. So that's an area where you might want to focus on, and also your teamwork. And there are research tools out there that allow you to measure some of these things. There's a rather good tool, I can't remember the name right now, I didn't put it in the reference list, from Copenhagen, that looks at stress within an organisation. And it's free to use. You need to seek permission, but it's free to use. Another one is the Safety Attitudes Questionnaire, which has been around for quite some time, and there's various versions of that. It's free to use, but again, you do need to seek permission before you use those. Both of them are, the Safety Attitudes Questionnaire is from University in the US, University of Texas. So that's some of the stuff in terms of aged care, and then in terms of hospitals, and the aged care area is also fairly similar. I just need to look at my notes on that. So again, around compassion fatigue, burnout, emotional exhaustion has an impact on the way that you work with and communicate with your consumers, and that can affect the way that you're planning and the way you're able to deliver personal and clinical care. It also, and things like workload as well come into that, and that's one of the reasons why the care minutes have been introduced into the aged care sector. And also, again, the workplace violence and safety and psychosocial safety environment comes under your service environment for your workplace, and human resources, standard 7, then making sure that you've got your skilled workers that are qualified and that they're engaged and you're not so stressed and overworked workforce is something that has an impact in that. And training on the managing of psychosocial risks as well is something coming under that human resources area. And ultimately, most of this sits under your clinical governance, because that's where you have the systems in place as to how you're going to evaluate. So in terms of the PDCA, PDSA cycle, then it's a matter of what is the area that you have your concern in, how do you get some initial data, or what initial data do you have, what is it that you want to implement in terms of this. So it might be an education program, or in most cases it would have a form of an education program. Then you need that pre-data, then you have the intervention that you're putting in place, and then you have the post evaluation. So I've probably got a little bit of time to talk about some of the impacts on the individual. I think I've probably gone over that around the stress and burnout and the trauma. And in terms of the organisational, I did mention the drag costing tool earlier, so that's something that you can use to cost. A lot of places are now using agency or having to use agency staff, and there's costs associated with that. But things like how long it takes for you to employ somebody as well. So you're working in a really, really competitive market at the moment in terms of attracting skilled workers. There's a massive shortage of health workers globally, and Australia is situated in that, and then you're looking at the different industries as well. And so there's a large competitive environment. So if you're not quick to snap someone up when they apply, then it's possible that they may go somewhere else. And so, how long does it take you from when you advertise to when you actually have somebody in place? And the processes around that. And I am aware that checks have to, there's checks in terms of working with vulnerable people, checks, and the and qualifications checks, and for overseas people that's actually quite a lengthy process. I am quite aware of that, but how can you streamline that? That might be something that you want to look at. It might be that you have high levels of sick leave and you need to look at, well, what is it about trying to get some data and information around what might be causing that spike in sick leave. Is it that there's various illnesses going around, or is there some other underlying, is that a symptom of something else underlying in your organisation within that workplace, within your workplace? Is there something going on at a cultural level? And how to, so that's where you might look at something like a safety climate survey, or some other form of getting information from your staff. So we're pretty much close to 1:15, and I did want to allow a decent amount of time for questions. So I'll hand it back to you, Stephanie.
All right. Thank you. So there is time for people to type their questions for our presenter today, Dr. Deb Carnes from Resilience Coach. So please use the chat window to type any questions that you have for today's presenter. And as Deb said, today's webinar has also been recorded, so you're welcome to go back and rewatch today's presentation or share the presentation. And all webinars during WorkSafe month will be made available on WorkSafe Tasmania's YouTube page. So a question, Deb, what role can the team leader, middle manager or supervisor play?
That's a really good question, because your team leader and middle management and supervisor are often in, I call it the sandwich role, because you have the frontline clinicians, and then you have your leadership, your team leader, and that middle management, and then the higher level managers. And so you've got the need to work. I guess it's about, you're in that role where you are working close enough to the front line to have the relationships to be able to, I guess, communicate's not the word I'm wanting. Assess and have a better view of what's actually happening on the floor. And you are probably going to be aware of potential issues before it shows up in any data. And how you create the relationships with your team is vital in that situation. So your role, I guess, is the eyes and ears and bringing in some of that information. But also then having to take that to the next level in terms of your overall organisational leadership, and that can sometimes be hard. That's where some of the stuff I've talked about today can be useful, when you have a document like the WHO Charter and the Code of practice for psychosocial management, management of psychosocial risk. Those are documents that outline what the requirements are in terms of meeting health and safety obligations. So you're the vital conduit between what's happening and the people who can work for the change at the overall organisational level, and then you're the conduit for that, implementing that organisational level policy into practice. Depending on the size of your team, it's very difficult to do large surveys. A lot of surveys are designed for larger numbers. So if you're working in a large organisation, then it may be that those types of surveys are something that you can advocate for to happen at across your whole organisation, so that the larger data pool can be broken down into something where you get stuff from your area. Or it may be that there's other more informal kind of qualitative approaches that you can look at if you're in a smaller organisation, where those sort of larger surveys are not so well, they're not so useful. So hopefully that answers your question.
Thank you, Deb.
Not type another one, please. Because it is a really tough role. You're often the person that has to, if there's some kind of bullying or issue similar to that, it's the team leaders that have to deal with that, which can be tough in a small team. Those dynamics, navigating that can be difficult. Is there any other questions?
No further questions coming through at this stage,
Okay.
Deb.
All right. So I just had a couple of other polls. So I just wanted to check that. So I'll move on to those if you like. How well did it meet the learning objectives? I will just put those up again so you can look at it. Oh, there they are. Okay, and I guess the other poll. Oh, sorry, there's still answers coming in. Yep.
Sorry, that's
fine.
That's all good.
Yeah, that was good. I saw those last ones come through, so that's good. Thank you for that, because I was a bit worried. Organisational, interesting. Okay. All right, that's really useful feedback. Thank you. I still got a little bit of time, so I might be able to expand a little in some of the organisational side of things. It's an area that I think, and it's it's the main reason why I put together. Well, I mentioned at the start, I've designed a full one-day workshop, and it was because I could see that there is, from my own practice. So I still practice as a nurse. I work for one of the agencies here in Hobart. I work primarily across mental health and aged care. And from my own experience working across numerous workplaces in the last 6 to 8 months, I have found that there's a large degree of variation. There's some places that I work that are really, really great. In terms of their team culture and the environment, they're really wonderful. But some of them, their processes of hiring are very, very slow. And also things like and the way staff orientation and those sorts of things happen is very, very disjointed in some areas as well. And so I felt that there's a need to go further into some of the organisational issues. So I'm really pleased that that's the area that you'd like some more information on, and I'll be working on some of this stuff with other stuff that I'm doing. It's an area that there is some good stuff out there, and I have got time to talk a little bit about. There's one of the references that I've put in. There's the ABC of clinical resilience, and that it's a really good reference around some of the things that can be done at that organisational level. A couple of groups that I haven't talked about haven't put in the bibliography. One is the Joint Commission in the United States. So they run accreditation programs in the US. They've got quite a lot of stuff on wellness and workplace wellbeing on their website. They've got a whole section on wellbeing. A lot of it's focused on physical wellbeing, but there's still some quite good resources there. And the other place that's starting to really push wellbeing is the Institute of Healthcare Improvement. Again, they are not in the bibliography, but you can just put their name into a search engine. They are the group that work with the BMJ to run all the patient safety and quality conferences. So BMJ Safety and Quality in the UK, there's an Asian one, there's an Australian one, and they also run a couple of conferences in the US, and they are really starting to focus on wellbeing as well. And a lot of the organisational things that you can do as well, the managing, I've just got a copy of it here, the managing psychosocial hazards at work gives you an idea of some of the things that and some processes around what you can actually do. It's just that I don't think there's any kind of one-stop shop at the moment. Some of the things that you can look at is, the rights of participants and responsibilities of providers and your governance, the sort of supports that you offer, and those sorts of things. I think it's a growing area in terms of how we address the issue, and I think that there's still a lot of learning to be done. But the fact that there is an interest in the space and people are now, I think there's always been an awareness, but I think there's a greater awareness now since the pandemic. Does anybody else have any further questions? I hope it was useful.
No additional questions are coming through at this stage,
Okay.
Deb.
Yeah, it's it's a system that's a little bit different to what I'm used to. I'm used to having sort of chat sort of flowing through while I'm talking as well. So I hope it has been useful. I hope you've got some useful resources in that bibliography that you can use to get you going in this space. And I think I've got my contact details there again. Yes, my contact details are there as well if you need to contact me. Well, thank you so much, Ingrid. I think I've got time to tell. tell a bit of a story, but one of the worst instances when I was working as a union organiser, one of the worst instances I dealt with was a case of sexual harassment, and the person I was working with was so stressed by it. At one point, her son found her in her garage, sitting, smashing her head against the floor, and that was, yeah, that was a pretty awful thing to have to sort of work with, and for her to be at that point. And I think that there's a lot more openness and discussion, and certainly a lot more resources now than there used to be on that particular subject. Yes. So thank you so much for your attendance, and thank you so much for your feedback. And thank you to WorkSafe for the opportunity.
No, thank you, Deb. So we'll wrap up today's webinar, Health Worker Wellbeing, Patient Safety and Healthcare Accreditation in Australia, Creating Alignment for Improving Outcomes. So we thank our presenter today from Resilience Coach, Dr. Deb Carnes, and thank you as well to everyone for attending. Today's presentation was run as part of WorkSafe Tasmania Month. WorkSafe Month is an initiative funded by the WorkCover Board Tasmania. Please head to worksafe.tas.gov.au to see what other in-person and webinar events we are running throughout the month of October. And to rewatch any of our WorkSafe Month webinars, please head to WorkSafe Tasmania's YouTube page. Thank you again to our presenter. Thank you for everyone for attending, and please have a safe and healthy day. Thanks.
Thank you.